Chris Van Gorder runs Scripps Health, one of the largest health organizations in San Diego County, with 5 hospitals, 26 clinics, and more than 13,000 employees. So, of course, we wanted to get his take on the Affordable Health Care Act and what's at stake when the U.S. Supreme Court makes its ruling later this year. Now, Chris, this isn't the first time that we've talked about health care. We profiled you in a KPBS documentary a couple years back, and I want to quote you, something that you told me a few years ago. You said health care would be cheaper for everyone if everyone had health care. So isn't that what the individual mandate attempts to do?
Well, it certainly is an attempt to try to get everybody insurance. Of course, whether or not people use the insurance in the right ways, for example, to try to keep themselves well, as opposed to just waiting until they get sick and then using the healthcare system. So, yeah, to some degree, you're correct. That's what it's about.
And do you support the individual mandate?
We need to find a way of getting everybody insured, either through their employer, the government, or themselves. So I guess in that context, yes, I would agree that everybody in this country should have some insurance of one kind or another.
Now, I know also in the past you've made the distinction in terms of defining what's wrong with healthcare, and you say it's really the economics of healthcare. What do you mean by that? Well,
healthcare is, I mean, to be honest with you, it's broken. And I'll be the first one to stand in front of anybody to say that the system doesn't work really for everybody right now. It works extraordinarily well if you're insured and you have access to great health care. For those people who are uninsured or underinsured, it's not the best system. The problem is, you know, in many ways, well, we have 21% uninsured in this state alone. That's 7 million people. So right off the bat, you know, the system is broken if 7 million, you know, California residents don't have health care insurance. The other thing is for years we've been cost shifting. The government does not pay their full cost of providing insurance for Medicare or Medicaid or even county medical services. And as a result, ever since the mid-60s, we've been cost shifting that portion of the cost on those people with private health care insurance. That's created part of the problem right now in the fact that about $1,400 out of everybody's premium annually goes to pay for those who are uninsured or underinsured. So if there was a mechanism to actually have everybody insured, you know, one could theorize it anyway that at least $1,400 would come out of your cost on an annual basis. So, and then the system itself is fragmented. It's we have developed in our country a sick business. I often call hospitals sick business. If you aren't sick, we're out of business, and we get reimbursed actually to take care of you when you're sick. We don't get paid to keep you well. And we believe, at least at Scripps, we believe that we have to change that model. And I think a lot of healthcare providers do. And actually start using a lot of our resources to keep you well. And we, you know, unlike what we've ever done in the past.
I want to talk a little bit about emergency rooms because I know this sort of plays into the uninsured. Often they show up there. The UT San Diego is running a series right now about frequent flyers, people who are there more than 6 times a year. Again, I'm going to quote you from another interview where you say that we do have a national healthcare system. It's called the emergency room. What do you mean by that?
Well, under the EMTALA laws, the federal regulations that require hospitals with a basic emergency room to take care of all comers. In theory, that means we're supposed to stabilize the patient and then they can be cared for elsewhere. But in San Diego, like a lot of counties now, there is no county health care system or hospital system. So if somebody comes to our emergency room, we have the legal responsibility and, frankly, the moral responsibility to take care of them regardless of their ability to pay. That is the healthcare delivery system in this country. Everybody has insurance through their emergency room, but it's also one of the most expensive ways to get care and not always the most appropriate. With the UT series that's running right now, you know, there's their old 80-20 rule. About 20% of the population uses 80% of those resources. The frequent flyer is about 1% out of that 20, and they use probably more than 80% of the dollars, the resources. So, you know, there alone, we need to find a way of providing housing and preventative care for these people so they don't end up taxing the 911 system, taxing the emergency rooms, and ultimately the hospitals, who in most cases don't end up getting reimbursed whatsoever for their care.
We haven't got a lot of time left, but before we go, ultimately, if the court strikes down this law, what happens to healthcare in California and in San Diego?
Well, it certainly is speculative because we don't know for sure what the Supreme Court will do, but a lot of the states right now are talking. California, the governor and the Secretary of HHS here in California has already said that California will take it on themselves. They've said that maybe they'll pass their own mandatory health insurance law in the state of California. The problem will be, where do we get the money to actually take care of all of those people who can't afford to buy insurance? There was about $55 billion coming from the federal government from 2014 to 2019 to cover all of those people. If it's found unconstitutional, that money in theory will dry up. Where will California get the money to do that?
Okay, Chris Van Gorder, Scripps Health, thanks for being here.
Thank you.